Ovarian cancer is the 8th most common cause of death for women across the world, in part because symptoms are hard to recognize.
We take an in-depth look at those sometimes confusing symptoms in a moment, but first we introduce you to a Missouri woman who also had no signs of ovarian cancer, but ended up accidentally detecting the disease on her own.
Reporter Kristen Crowley shares her story and shows us the potential medical breakthroughs looking to change the future of this deadly disease and save women's lives.
If you ask Kristen Baker about her career,
I've loved it so much.
you can see it's more than a job.
It's really wonderful there. I love all my patients.
Kristen has many reasons to love being an ultrasound tech, but perhaps the most important, her job likely saved her life.
We were working with a student, we had a break in our schedule. I was like, the best way to teach an ultrasound is having them do hands-on.
Hands-on meant the student practicing the ultrasound on Kristen, and the routine lesson became so much more.
As soon as she put that probe down, I was like, something's not right. I saw this like ascites or fluid in my abdomen around my liver, and usually that's not something good.
At that point, did you have any thought about what it was you were seeing?
Honestly, I saw a big mass, and that scared me. It was truly scary to see something like that.
You thought it was cancer?
Mm-hmm.
She'd seen enough scans of other patients to know what cancer looks like. Now the mass jumping off the screen was hers. It was ovarian cancer, stage 3. Kristen had been feeling full lately and a little bloated, but she blamed it on her diet and had no plans to see a doctor. After all, she was only 29 years old.
What would have happened if your student hadn't practiced that ultrasound on you that day?
I don't know. That's truly the scary thought. How long would I have gone without going to see a doctor about anything?
Have you ever had a patient who found their own cancer by doing an ultrasound on themselves?
No.
Wild story.
Yeah, no, absolutely.
Dr. Annie Jewell at the University of Kansas Health System is Kristen's doctor.
What would have happened if Kristen had not found her cancer in those scans?
I would imagine if she hadn't found this, probably within the next 6 to 12 weeks, she would have had symptoms severe enough that she would have come in.
But by then, Dr. Jewell says Kristen's body would have been worn down by the cancer and from lack of eating. It could have made the grueling chemotherapy treatments and invasive hysterectomy tougher to survive. And Kristen knows that firsthand. Her mother died from primary peritoneal cancer, a disease closely related to ovarian cancer.
Her going through all her cancer stuff really kind of set me up for my battle that I didn't know that was coming at the time.
Her mother was a late-stage diagnosis, as many women with these forms of cancer are.
Unfortunately, what we know from the data is that these are not super effective tests at helping us diagnose ovarian cancers early. So even when these are diagnosing ovarian cancers, they're still advanced beyond stage 1 and 2.
Women get mammograms to screen for breast cancer and pap smears to screen for cervical cancer. Those screenings save countless lives. Regular mammograms reduce the chance of breast cancer death by 40%. But many women believe pap smears also look for ovarian cancers. They're wrong.
Ovarian cancer is one of the cancers that we do not have a good screening test for it.
Even though it is the deadliest gynecological cancer, the technology to routinely search for it just doesn't exist. But that may be about to change.
I definitely think this is a huge breakthrough.
Joanna Burdett is a professor of pharmaceutical sciences at the University of Illinois in Chicago. She co-authored a study detailing the discovery of a new biomarker for ovarian cancer that could pave the way to routine screening for the disease.
It makes sense when you're thinking about doing a pap smear and sampling and looking in this area annually anyway. Is there some technology that would be powerful enough to detect cancer in this source, in this sample?
The biomarker can identify the body's immune response to cancer, which could alert doctors to the cancer sooner. But the research is ongoing, and more human trials are needed to see if it's the answer women's health has been waiting for.
Certainly, the sooner we find it, the better chance you have at chemotherapy working.
Early detection can save lives. And in Kristen's case, self-detection and a little bit of luck likely saved hers.
I feel like God put that student in my life and like that break that, I think it's truly incredible, and like I really don't know what I would have done if I didn't take her to go practice.
Kristen Baker has a gene mutation known as the BRCA gene, which makes her more susceptible to ovarian and breast cancer.
However, even with that risk factor, doctors say it was incredibly rare for her to develop the cancer under 30, and incredibly lucky she found the disease herself. Doctors say the most relevant tools for finding ovarian cancer are imaging tests such as an ultrasound and CT scans of the pelvis and abdomen, and tumor markers that can be found in blood such as cancer antigen 125.
Symptoms of ovarian cancer are often vague, and the Mayo Clinic says they can occur with several common conditions. Those symptoms include abdominal bloating, pelvic pain, urinary frequency or urgency, losing weight for no reason, and feeling full more quickly when eating.
Experiencing these symptoms doesn't mean you have ovarian cancer, but discussing them with your healthcare provider is a good idea.